How many people are we talking about here that would be added on to North Carolina's Medicaid rolls?
Yeah, about 500,000 would be added to the rolls. Right now, if you look at the program, it currently serves about 2 million people in our state, and it costs total state and federal funds combined about $14 billion. So it's one of the fastest growing line items in our state budget. And with expansion, yes, it would include those people who are currently in the coverage gap, meaning that they don't qualify for Medicaid and they don't bring enough income to qualify for a subsidized private health plan if they don't get health insurance through their job and they're working. But it also would shift a lot of people who are currently receiving subsidies with private plans on the exchanges onto Medicaid. And Medicaid is a program that has a far inferior track record than most other types of health insurance.
Now, let me make sure I understand, because that seems pretty important. Are you saying that of these 500,000 people that would be added under this proposal, that some of them currently have insurance?
Yes. A lot.
Why would we take them out?
We're talking about 1/3 of the exchange population, and again, the exchange is if you don't have health insurance through your employer, you get it on your own, and depending on your income, you can qualify for a subsidy to purchase a health insurance plan. So yes, it would be shifting about 1/3 of the exchange population onto Medicaid.
Katherine, you also mentioned that the idea behind Medicaid was really to be a social safety net for those folks who are very, very vulnerable, can't take care of themselves, and as a compassionate civil society, we would make sure that they were cared for. But as this program expands, what happens to those folks who really are qualified for this program and they're trying to get access to health care? And
I'm so glad you bring up that point, because that's really the critical point of all of this. So we go back to access and to healthcare costs. When you have more people on a program, on this pool, and there's less of a supply, primary care providers, other primary care physicians that can take care of these people. I mean, the traditional Medicaid population, the low-income children, elderly, blind, and disabled people, they're going to be competing harder for adequate access to health care. And fewer doctors are accepting new Medicaid patients.
Why is that?
Simply because Medicaid pays well below market rates, well below what commercial insurance companies reimburse their providers they contract with, and well below Medicare.